Endodontic retreatment represents a critical juncture in a tooth's life. It signifies that a previous attempt at saving the tooth has fallen short. This can be due to missed anatomy or persistent infection. The challenge is addressing these issues to maximize long-term success. Retreatment is about a fresh perspective, armed with knowledge and tools. It often presents a greater technical challenge than the initial procedure. Existing root canal fillings must be carefully removed. Canals need to be meticulously cleaned and shaped. Successful retreatment means preserving the natural tooth. For the clinician, it represents the pinnacle of endodontic expertise. The cornerstone of any successful endodontic retreatment is a comprehensive and accurate diagnosis. This begins with a detailed assessment of the patient's symptoms and medical history. Are they experiencing pain? What is the nature and location of the pain? Have they had any previous treatment for this tooth? These are just a few of the questions that need to be explored to gain a clear understanding of the patient's current condition. Clinical examination is the next crucial step. Visual inspection of the tooth and surrounding tissues can reveal signs of inflammation, swelling, or sinus tracts. Palpation and percussion tests provide information about the tooth's response to pressure and can help pinpoint the source of pain. Mobility testing assesses the integrity of the periodontal ligament and the extent of any potential damage. Radiographic analysis is indispensable in endodontic retreatment. Periapical radiographs provide a two-dimensional view of the tooth and surrounding bone, revealing the presence of periapical lesions, the length of existing root canal fillings, and the overall anatomy of the root canal system. However, in complex cases, conventional radiographs may not provide sufficient detail. Thorough cleaning and shaping of the root canal system constitute the very foundation of successful endodontic retreatment. This stage focuses on eliminating bacteria and infected debris, creating a pristine environment conducive to healing. Achieving this goal necessitates meticulous attention to detail and the utilization of specialized instruments and techniques. The initial step involves accessing the pulp chamber and removing the existing root canal filling material. This can be accomplished using a variety of instruments, including rotary instruments, ultrasonic tips, and hand files. The choice of instrument depends on the type of filling material, the complexity of the canal anatomy, and the clinician's preference. Once the canal is accessed, the next challenge lies in negotiating and shaping the often narrowed and irregularly shaped canals. This process involves using a sequence of progressively larger instruments to remove dentin from the canal walls, creating a smooth, tapered shape that facilitates effective cleaning, disinfection, and subsequent obturation. Irrigation plays a pivotal role in removing debris and disinfecting the root canal system. Sodium hypochlorite, a potent antimicrobial agent, remains the gold standard irrigant in endodontics. It effectively dissolves organic matter and neutralizes bacterial byproducts. Delivering the irrigant with agitation using techniques like ultrasonic activation or specialized irrigation needles enhances its effectiveness and ensures optimal cleaning of the intricate canal system. Section 4. Mastering obstruction removal. Dealing with obstructions in the root canal system is a common challenge in endodontic retreatment. These obstructions can be calcifications, broken instruments, or misplaced restorative materials. Their presence complicates the procedure, making cleaning and shaping difficult. Identifying the obstruction's type and location is crucial. Radiographs help visualize the anatomy and obstruction position. CBCT imaging provides invaluable three-dimensional information, allowing precise assessment of the obstruction. Various techniques and instruments can be used for removal. Ultrasonic instruments are effective in breaking down calcifications. Specialized micro-instruments like bypass files and orifice shapers navigate around obstructions. Magnification is essential for obstruction removal. Using a dental microscope or magnification loops enhances visualization. This allows for greater precision and control, especially important when dealing with delicate structures. Section 5. Managing apical complications. Managing apical complications is a critical aspect of endodontic retreatment, as persistent infection or inflammation in this region can hinder healing and jeopardize the long-term success of the procedure. These complications can arise from various factors including persistent bacteria, extruded debris, or the presence of a true cyst or granuloma. Accurate diagnosis of the apical condition is paramount for determining the appropriate treatment approach. Clinical examination, radiographic findings, and the patient's symptoms provide valuable information. In some cases, a biopsy of the apical lesion may be necessary to rule out other pathological conditions. Non-surgical management is often the first line of treatment for apical periodontitis. This typically involves thorough cleaning and shaping of the root canal system, ensuring adequate disinfection with irrigants like sodium hypochlorite and calcium hydroxide, and placement of a temporary filling with a corticosteroid-containing medication to reduce inflammation.